Name's Leanne Simons. I'm a registered dietitian nutritionist, a licensed dietitian nutritionist in the great state of Massachusetts, and an adjunct professor at Babson College and Bentley University. I teach science to non-science students, and I'm also an all-round skeptic. So this is a topic that's of great interest to me. I'm calling it, "What do you mean if my supplements aren't safe?" And I'm going to talk to you about the role of the FDA, drugs and food, with the DSHEA Act. I'm not telling you what these mean because I'm saving it. Herbs and supplements. And then after giving you all this information, I'm going to tell you what you can do when it comes to making decisions about supplements. All right, let's go. So the U.S. Food and Drug Administration, the FDA, is the government organization that controls the food industry and most of the food industry and all of the drug marketing in the United States. When we talk, let me just move myself out of the way. And when we're talking about the FDA and drug regulation, well, the thing about drugs is that they require a lot of research before they go to market. And the FDA feels really strongly about that. The research is really tightly regulated. Evidence has to be presented to the FDA from the drug company, and new drugs have to show or have to demonstrate both safety and efficacy before they go to market. So I want to talk to you about something called the DSHEA Act, or the Dietary Supplement and Health Education Act. In 1994, Congress passed this legislation called DSHEA, the Dietary Supplement and Health Education Act. It was legislation pertaining to the sales, marketing, labeling, safety, and support statements made on what they were calling nutritional supplements. Now, when we talk about food and FDA regulation, the FDA oversees all foods except for meat and poultry. That's a different story, which we won't talk about today. But the food that they oversee, food is comparatively little research is required when food goes to market. They want to make sure it's safe, but they don't really research it. So it's kind of loosely regulated. Now, as a result of the Dietary Supplement and Health Education Act, the following are now defined as food: supplements, herbs, enzymes, things called glandulars, vitamins, minerals, and fiber. These are now categorized as food. And what I want you to understand is, yes, all these things, including nutrition supplements, are considered food by the FDA. And because they're considered food, rigorous testing and research is not required for them before they go to market. These are the different nutritional categories. I just briefly mentioned some of them. We have vitamins that are essential and non-essential, essential and non-essential minerals. And let me just tell you, because this is something I tell my nutrition students, essential means that the body doesn't make it, and so we have to get it in our diet. Non-essential means our body makes it, and so we don't need to get it in our diet. And they're selling us non-essential vitamins and minerals. Also things called nutrition substances like glucosamine and chondroitin, things that are sold as sports supplements. I used to know what HMB is, but there's so many other things out there. I'm not even trying to remember it. Things called glandulars, enzymes, and herbs. These are the different nutrition categories. And all herbal preparations, all herbal supplements are recognized as food. Herbs have drug effects, and I'll show you some of them, how a number of medications are made from herbs. And they're used for medicinal purposes. The thing is, if you use an herb, you really need to understand the qualities and effects of the herb. Where was it grown? What is the active ingredient? How are you supposed to prepare it? And the FDA defines herbal supplements as food. And since they're defined as food, well, they're not regulated for safety, for efficacy. You see, herbs, well, the amount of the active ingredient, we don't know what it is. That's the thing about medications, is that when you take, well, actually, let me wait till I get to that slide and I'll talk to you about that. But there is concern that because they're regulated as food, you don't know the amount of the active ingredient that's present in the product. And there could be potential side effects from toxic ingredients. And there may be very high amounts of these ingredients that can make you sick, but you don't know because they're not regulated. And what that means is what's on the label isn't necessarily what's in the product. That's my main concern about supplements. Because they're regulated as food, what's on, and not drugs, what's on the label isn't necessarily what's in the product. So I have this example of a supplement. A lot of people think probiotics are really important, and so they take these supplements. This is, on the left, probiotics to support digestion, health, and immunity. Now, what does that mean to you? Supports digestion, health, and immunity. Because they're making this claim, but here on the right, in that small print, these statements have not been evaluated by the Food and Drug Administration. This product is not intended to diagnose, treat, cure, or prevent any illness. But why are people taking these supplements? Why do people take things? Are they diagnosing, treating, trying to cure or prevent any illnesses? Relax, Leanne. So your supplements, the supplement on the left, they're not medication. And yet people take them as medication. And that's a problem. People think that because you can find it in your pharmacy, that it's regulated because you get your medication in a pharmacy. And again, and I can't state it enough, supplements are not regulated. What's on the label isn't necessarily what's in the product. But what I do, well, let me just show you, because I want to say I believe that herbs are drugs. I talk about it as nature's pharmacy. I have a colleague at one of the places where I teach who says herbs aren't drugs. I say herbs are drugs. It depends on whose class you're taking, what you need to know for the exam. My point being that from the herb, we get the medication. So for example, the foxglove plant, we get the medication digitalis, which is used to treat heart failure. From the Pacific yew, Taxol has been isolated and made to help treat ovarian cancer. The French lilac, the drug metformin that's used to help control blood sugars in type 2 diabetes. The willow bark isolated the salicylic acid, created acetylsalicylic acid, and now aspirin. Oops, and let me just move myself out for a second. The cinchona, the bark, quinine, which is used to treat malaria. Now, the thing I want to tell you about herbs versus medication is that, as I said previously, when you are using an herb, you don't know how much of the active ingredient is in it. You don't know what it may have been contaminated with. But with the medication, the ingredient has been isolated. It has been tested. It's been gone through clinical trials so that you know how much of an active ingredient you're getting, you know what potential side effects are, and you have a place to report if you're having what's called an adverse event, something that you don't think should be associated, you're not feeling well and it's not something that's supposed to be a side effect, you have an agency to contact if you get sick from taking a medication. When you get sick from taking an herbal product or any kind of supplement, there's no place for you to call. And if there is a place for you to call, it's not a government agency. They have no responsibility for dealing with those adverse events. So I had a friend who once asked me if she should take, what was it called, red yeast rice extract instead of a cholesterol lowering medication. And I said, no, I think you should take the medication. Why? Because red yeast rice extract, while it does contain something called a monocholine, that monocholine, again, you don't know how much of it is in your red yeast rice extract. But when you take a medication, it's been isolated, it's been standardized. You can know what the effects were when it was gone through clinical trials. And if you're fortunate, your insurance will cover it. So I recommended she take the medication. I don't know what she did. So let me just kind of say this again. Drugs, medications require substantial research, and they're tightly regulated by the Food and Drug Administration. The evidence is presented to the FDA by the drug company, and new drug approval requires research demonstrating both safety and effectiveness or efficacy, right? So all this is supposed to go into play before it gets to market, before it can be prescribed under most circumstances. We'll say COVID notwithstanding. So that's how drugs are involved with the FDA. But again, when we're talking about supplements, they define them in nutritional categories, and they're defined and regulated as food. So what's on the label isn't necessarily what's in the product. Remember, what you see on the label, the statements, and I'll show you some of those in a minute. Remember, there should also be a little tiny box on the bottle somewhere that says, these statements have not been evaluated by the FDA. This product is not intended to diagnose, treat, cure, or prevent any disease. I want to go over some of these claims with you because there are folks that think that the government, that these supplements are regulated, that there have been laws passed. And what I need to tell you is that the only regulation, if you will, has to do with what's called permissible claims and prohibited claims. Under the prohibited claims, reduced pain and stiffness associated with arthritis. But they are allowed to say promotes relaxation. Do you think someone with arthritis would want to take that supplement, something that promotes relaxation, when having arthritis pain makes you stiff? Yes. They're prohibited to call their supplement a laxative, but they're allowed to say promotes regularity. Why would someone who's not having digestive issues want to promote regularity? Just asking. Prevents Alzheimer's disease. Not allowed to say that. What they can say is that it reduces absent-mindedness. And I find this one of the more, you have a family that somebody is beginning to develop symptoms of Alzheimer's, or they're starting to lose their memory, or you're starting to forget things, and your fear is memory loss. And what can you do to halt that progression if indeed that's what's going on? Well, if you don't qualify for any kind of medication, you might go to the drugstore or wherever and see a supplement that advertises itself as reduces absent-mindedness. And why are you taking it? Because you're concerned about progressive memory loss. A supplement is not allowed to say that it's antiviral, but it can say it promotes the immune system. Why would you want to take a supplement that supports the immune system if you weren't concerned about getting sick? And just as a kind of aside, I also, in addition to nutrition, I teach a class called Health and Disease, and I cover a topic called infection and immunity, usually in the middle of the semester, but you know, global events dictate that I moved it up to the beginning of the semester. And if you're promoting or boosting your immune system, when your immune system's working, you have fever, you have aches, you have pain. All of these things are what happen when you stimulate the immune system. So I tell people you don't want to take something that promotes your immune system unless it's a vaccine. They're not allowed, supplements are not allowed to advertise themselves as antidepressants, but they can say reduces frustration or rejuvenation. So there are permissible claims and prohibited claims. And people take them because they can't see the prohibited claims. I want to show you this product because just this past weekend, there was in the comics something about this product, and it was sent to me by a couple of people, so I thought I would include it. Prevagen is a supplement that advertises itself as improving memory. It's not allowed to say, you know, prevents anything. Let's see, what was the prevent? I've already forgotten. Prevents Alzheimer's disease. It can't say that, but it can say it improves memory, that it supports healthy brain function, a sharper mind, and clearer thinking. It can't say prevent, but look at the first 4 letters of the name of this product. Kind of somewhere in there, somebody worked that out that, oh, we can't say prevent, but we can make it in our name. I'm seeing some comments, so I'm just going to look at them right now. Oh, eat your yogurt probiotics. We can talk about that when I'm done. My friend and her mom both take large amounts of vitamin C. Does this even help? Well, it makes you have very expensive urine. What our body doesn't use, it excretes. There have been some studies that suggest that it may reduce the severity and duration of the symptoms, but we don't have anything that will prevent a cold. And you can, 1,000 milligrams a day is an awful lot. And with respect to COVID, nothing. That's another concern that I have with some of these supplements is maybe they've been shown to have some effect in one area, but suddenly the industry then promotes it in all areas. So beware. Yes, always eat the fruit. So the thing about Prevagen, I have a good friend and neighbor who's a neurologist, and she's one of the people that sent me the cartoon I'm about to show you. Actually, I'm going to show it to you now. I don't know if any of you saw this over the weekend in the comics. It's a Doonesbury comic. I've been following him for, I don't want to tell you how long. And it's not because I forgot, but it's about placebos, the fake pills, but people take it because they think it works for them. And they're specifically talking about Prevagen. And my friend was telling me that one of the things you do as a neurologist is work with people who have dementia, are developing dementia, and they have Alzheimer's or family members. And she says it's a rare day in the office and certainly never a whole week without me having to give my Prevagen spiel. Maybe now I can just hand out the comic. I want to show you some other, what I'm calling tainted supplements. I got this from the US FDA from their website because, again, they only find out about this when a number of people call them and complain. There's nothing on these products for places for you to call if you're having adverse effects. They sometimes, and I'll talk about this in a minute, there are organizations that will randomly test supplements. And these 4 have been shown to not contain what they say they do, or to contain, well, for example, Dr. Schultz's Super Slim, whatever that is. There have been weight loss supplements that have shown up with Meridia, or I forget what it's called, but the Meridia was a weight loss drug that went through clinical trials that showed enough safety and efficacy that the FDA approved it. But once it went to market, instead of 8,000 people having been in the clinical trials who took it, and I bet it's not even 8,000, but suddenly you had 800,000 people taking it. So you were seeing side effects that you didn't see during the clinical trials. So it was pulled off the market, and it has been showing up in these weight loss products because they don't have to put on the label what's in their product. And then we have Adam's Secret over here in the lower left. That's for sexual dysfunction, right, that men will take. And a number of these kinds of supplements have shown to have Viagra in them. You don't see that on the label because they don't have to put it there. On eBay, there are drugs that are being pulled, or supplements that are shown to have drugs in them. Let the buyer beware. And then we have homeopathic remedies, over-the-counter products, and they'll make all these claims. Here are some of the claims that you might see on these over-the-counter products that, well, they can say because they're not the prohibited claims, they're the permitted claims, reduces severity and length of the flu, boosts your immunity naturally without a flu shot, safe and effective alternative to flu vaccine, prevents, actually this one's saying it, I knew that one bothered me. Prevents catching the flu, effective treatment for the flu, supports your body's natural immune defenses to fight off the flu. Be aware that there are no legally marketed over-the-counter drugs to prevent or cure the flu. There are legal over-the-counter products that can help reduce fever and relieve muscle aches to treat symptoms of the flu. But products that are sold like this are fraudulent if they claim to prevent, treat, or cure, and they have not been evaluated by the FDA for that intended use. Let the buyer beware. Some more, especially with COVID, people are looking to prevent COVID, to treat COVID, and there are no supplements out there that have been shown to have any effect on COVID. None. No zinc, no vitamin C, no elderberry, no honey, no silver. Best thing you can do to reduce your risk, wear a mask, wash your hands, maintain social distance, and get the vaccine when it becomes available to you. So now that I've told you all this fun stuff, what can you do? You can be a conscious consumer. If you are looking for supplements, you want to look for these on the label, all right? You want to see NSF International. You want to see USP verified, not US Pharma. There is a snake oil group out there that has USPHARMA. And they're trying to look like this. That's not legitimate. You want to see the consumerlab.com logo or informed choice. These are the things you need to look for on a label if you're buying a supplement. And I wouldn't, well, I can answer your questions in a second. And I can answer your questions right now. All right, let's see. What about calcium? What about calcium as a supplement? Is that what you're asking? There are different forms of calcium, so you need to make sure that you're getting the kind. There's calcium carbonate, there's calcium citrate. Calcium carbonate is what's in Tums. It's what's in Viactive, the chews. Let's see. And you need to take that with food because it's digested and absorbed better in the presence of stomach acid. And stomach acid is produced when you're eating. Calcium citrate does not need to be taken with food. So you can take that on an empty stomach. And if your doctor is recommending a calcium supplement, or if you know diet-wise that you're not getting adequate calcium, just make sure, and it's easy for me to say because this is what I do. It's recommended to try to stay under 2,500 milligrams of calcium between your supplements and your diet. So you may want to talk to someone to find out how much calcium you're consuming in your diet. I heard that if you don't get enough calcium as a kid or a teen, there's nothing you can do to strengthen your bones when older. No. On the one hand, I have a serious bias because I'm 66 and I like to think that there's a way I can increase my bone density. And two, there is data that suggests that weight bearing exercise at any age can improve bone density, that it can help stimulate the bone building cells. But yes, it's true. I mean, I hate it. I've only started doing the weight stuff, but yes, that is a concern, but it doesn't mean that it's a, let's see, a verdict that you're going to fracture your bones when you are of an age. So if it's being recommended for you to take calcium, if your doctor's recommending it, or if you're not sure what your doctor's talking about and you ask to talk to somebody who specializes in bone health, I would defer to their expertise in the area. But I certainly would rather see people get it from food than from a supplement. And let me tell you why. When you take a calcium supplement, all you're getting is calcium. But when you eat, let's say you can drink milk. If you drink milk, you're getting lactose, you're getting vitamin D, you're getting calories, you're getting other nutrients that may all work together to help the body use the calcium more effectively. So that's why I'd rather see people eat whole foods rather than take supplements. I've heard ads for calcium supplements are false. I'm not sure what ads you're referring to. Missed the first few minutes. You take vitamin D and CoQ10. Am I saying you shouldn't take any supplements or just that you should be careful? If you're going to take a supplement, please refer back to what I was saying. Let's see, or maybe I can refer back for you. I would want you to make sure that you see these on the label, because then you know that what's on the label is in the product. That's what I ask you to pay attention to. If you are recommended to take a supplement, you want to make sure that what's on the label is in the product. And if you see these on the label, then that's what's in the product. Do I recommend supplemental probiotics in any situation? People, I'm not sure what probiotics have to do with vitamin D. What I actually recommend to folks is to eat what's called prebiotics. And let me first explain why I don't recommend probiotics. Probiotics are bacteria, right? Or supposedly bacteria that are supposed to help your gut health, because we have lots of bacteria in our system. But everybody's gut health is different, right? Everybody's strains of bacteria can be different. There are some ones that everybody has for sure. But the supplement that you take, first of all, you don't know how much live bacteria is in it. Second of all, is it going to survive the acid of the digestive tract? It's one thing to get it in your stomach. It's the other thing for it to go from the acid in your stomach through your digestive tract, through your intestinal walls into your bloodstream. Or, I'm sorry, not those, but to get through your small intestine into your large intestine. So I recommend what are called prebiotics. Prebiotics are foods that don't completely get digested in the stomach or the small intestine. And it's not until they get to the large intestine. I'm giving you an anatomy lesson. Do you know what I'm talking about? But there are bacteria in the large intestine that will then look at these prebiotics as food, and they'll break them down and make the bacteria that goes in your intestine. What are some sources of prebiotics? For some reason, Jerusalem artichokes are a source of prebiotics, and green bananas, but also beans and grains. Those are prebiotics. So I recommend prebiotics. I have heard that supplements improve. I've used supplements. Well, I disagree with the nurses in the clinic. I don't see any reason to take evening primrose oil. I don't have to answer all of these. Oh, I'm seeing the ones that are coming across my screen. I don't see a reason to take evening primrose oil. But I don't know what it does. I don't know where it comes from. I don't know the quality of the product. I don't know where the data is. I'm data driven. And if I'm working for a health agency, I need to see the data before I make the recommendation to somebody else. And I have never seen any data supporting the use of evening primrose oil. What about Nature's Bounty cranberry pills? Again, I haven't seen the data. I tell my students, if you can show me the trials where the results showed that this was more effective than placebo, then I'll recommend it. But I can't ethically tell people I have not read anything about cranberry pills to prevent UTIs. So I'm sorry. Other questions? Be safe. Whatever you're doing for yourself, just make sure you're being safe. Someone asked about fish oils and omega-3s. That's a really good question. I was in the VITAL study, the vitamin D and omega-3. It was a 5-year study, and I was on the omega-3s and the placebo vitamin D, and I'm also on Lipitor. So in terms of cholesterol, didn't help me, but I'm just one person. I will tell you the results did not show that it had any improvement on reducing risk for heart disease, whereas eating foods that are high in omega-3s appear to, and that may be because those foods and the person eating those foods has a lifestyle that is associated with a reduced risk for heart disease. I don't know what a mycological substance is. Mycology, I'm thinking, is fungus or mushrooms, but I don't know anything about mycology supplements. I don't know where you access the recording. I want to know that too. Can I talk about the gut microbiome? Well, I could, but it's a huge topic, and we're at the beginning stages of the gut microbiome. People want everything to be related to gut health, and I'm waiting to see the data. There's a lot of work being done. There's people I respect who are working on the gut microbiome. I have a feeling it's not going to be as life-changing as we want it to be, but that's just because there's no one thing. That it's all part of a lifestyle, you know, that includes not smoking and being active and having friends and family and support and all the other things that make you a well person. So I hope to know more about it, but I don't right now. Oh, okay. So I'm sorry about that. Anything else? All right. Well, thank you for taking your time to be with me. Any feedback would be greatly appreciated. And I was there where that picture was taken. It's in Antarctica, you know, in the before time. Bye-bye. Stay safe. You're very welcome.